A very good evening. You're watching the India Development Debate. I'm Tamanna Inamdar, bringing you the show today from a very different setting. We are in the middle of an unprecedented time. One of the biggest social experiments and acute need right now to ensure that the number of cases of those infected by COVID-19 in India does not escalate is social distancing. One of the tools is work from home. Today, that's what I'm doing. I'm working from home and I'm bringing you the show along with my team, who are also, a lot of them, working from home, scattered across the city and the country. So before we start the discussion and we talk about the latest as far as the fight against COVID-19 is concerned, just a few quick tips on working from home. And remember, we're all living and learning this. As a television journalist, I did not think there would be a day when I would be hosting a show from home like this. But yes, don't complain about your Wi-Fi. Find a way to make it work. Don't disappear on your colleagues. Give it all you have, because we all have to do our bit. But let's come to the matter at hand. Markets are still spooked by COVID-19, trying to grapple with the truth of how far this can go. Uncertainty is across the board. But for India right now, the fight is to keep the numbers down. So here's the latest coming in. The number of cases are 137. At this point, there have been 3 deaths. The highest number of cases still continue to be in the state of Maharashtra, and emergency measures are in place. In fact, Maharashtra Chief Minister Uddhav Thackeray has warned that public transport will be shut down if people do not refrain from traveling for unnecessary things. We have to reduce the number of crowds on the roads. It is an imperative at this point. The other big development and how India is fighting back against the coronavirus is testing. On this show yesterday, we raised the question about whether we are testing enough. Well, the authorities seem to be listening and are responding. The testing for the virus is expected to be increased to 8,000 per day from 500 currently. The ICMR, that is the medical representatives body, is now allowing private laboratories to test for COVID-19 and urging them to do this for free. Well, frankly, they must do it for free, because the more we test, the more we know and the more we can hope to fight COVID-19. So today we're going to talk about all of these measures which are coming in. On the other hand, how we prepared to deal with the economic fallout. Is it time to start thinking about some kind of compensation, universal basic income, for those who are at home without pay and cannot move out? A number of questions to answer. Speaking to me on some of them today are Dr. A. Velumani, CEO and MD of Thyrocare. I'm also speaking with market expert U.R. Bhatt. Today on the show, Dr. K.K. Agarwal, former IMA president, is joining us, as is Anand Bhan, global health and policy expert. All of us connected through remote locations, hoping to bring you messages of safety which can help you. Welcome to all of you on the show. Dr. Velumani, let me begin by just getting your views on private testing. And I think that's the need of the hour. What is the level of preparedness, and how soon can we come to private testing? What would be its outcome?
I think government has enough number of laboratories as of today. But as you say, only 500 people are screened a day. That number is too small for the number of laboratories government has got. It says either people are not willing to come for testing, or government is not accepting all who come for testing. What I understand as a private laboratory operator, from the calls and mails and enquiries which we receive, many want to get tested. Obviously, there is a panic-driven market, panic-driven demand. I would be very happy to see if these 100 odd laboratories which are recognized, approved by the government, if they can do roughly around 5,000 screening a day, that would say whether private need to get in or not. It looks like government doesn't find a need, and it looks like the society feels government is blocking. I think it is both way we need to analyze and see at which point of time a private laboratory testing should be encouraged and approved.
You know, you're absolutely right. Only those who require should be tested. Indiscriminate testing may be not the need of the hour. But the fact is that we are at stage 2. We have a precedent on how, the disease has worked, and suddenly there's been an avalanche of numbers of those infected in other countries. When we're looking for ways to fight it and avoid being in that situation, isn't testing one of those tools? And won't private testing then come into play sooner or later? Would players like you be willing to do this without a cost, taken of course from the patients?
Actually, it is not a cholesterol test or it is not a diabetes test where the raw material costs are very low and reagents are readily available. If we have to do a PCR test for COVID, the raw material cost itself runs to roughly around 2,000 rupees. And then pre-analytical, that is the swab collection task, is a very big task. When a private operator has to send a technician to the home of a patient who requires test, it is not that simple. It is quite costly because a lot of protective gears have to be spent on between the patient giving blood to result delivered. There should be half a dozen number of protective gears changing in between. So the costs are exorbitant, and I don't think any laboratory can afford to do it free of cost. I think when we laboratories are looking for support from the government like many other industries, asking us to do free of cost would be too harsh and it will be too difficult.
Well, an important point there. Let me go across to Dr. K.K. Agarwal. Dr. Agarwal, your view really on where we stand as of today. We've heard from the Health Ministry a short while ago. We've heard from the ICMR as well, saying that the aim is to increase the number of those being tested. It is perhaps the need of the hour. Do you think that private testing is now imperative? How would it work out, and how can we avoid seeing the sudden increase and jump in numbers after stage 2 that we've seen in different parts of the world? At India, we're still at decent numbers. The fear is that we'll jump up. How do we avoid that happening?
See, there are two types of policies. One is a South Korean policy where you do large number of tests on asymptomatic cases. There you will find a mortality of 0.6 to 1%. Today's mortality in total in South Korea is 1%. Another countries are like India, who is going into a policy of testing only symptomatic cases. And if you see Indian mortality, in asymptomatic cases, the mortality will be 1 to 2%. And in India, 3 deaths with 137 cases, the mortality approximately comes out to be 2.1 or 2%, which is fine. So India is basically going on a restricting policy for testing. So therefore, they are only taking symptomatic cases. For one symptomatic case, you will miss 50 asymptomatic cases. So you will be missing 50 times the cases in asymptomatic. But the people who believe in this theory is they feel that asymptomatic patients cannot transmit. Now, India has done is they have blocked their borders, new patients are not coming, and new visitors are not coming. All visitors who are coming are being put on 14 days quarantine. And whatever number you have, in 14 days, whosoever becomes symptomatic, they will test, isolate, and treat. So that's one policy, therefore, which is also fairly a good policy because both the policies are acceptable. Though personally, I agree test and test policy more important because less number of people will have mental confusion. And if your test becomes positive on day 1, and if you quarantine a patient who is negative, and 14 days later when he is cleared, he develops actually infection, he probably will go for a 1-month quarantine, which will be a lot of mental pressure on the person. But at this moment, the policy is watch and wait, that we have closed import of virus from outside, and whatever numbers are there, let them develop infection, and within 2 weeks, if we can have all the patients who can possibly develop severe infection, we treat them. And in such a situation, we expect a mortality of 1 to 2% in symptomatic cases.
Let's just review what the response has been from India so far, and the relatively quick cutoff of people coming in has been a good one. Quarantine has also been a good one. But the fact is that before the world could figure out what's happening and how severe this really is, a lot of people may have now entered the country, may be difficult to track. So let me go across to Inamdar for his point of view. Social distancing seems to be the norm right now. A lot of people working from home, but then let's remember that the formal employment in India is limited. So when you're asking offices and corporates to keep half its workforce from home, you can possibly implement it there. What about the large number of people working in the informal sector who need to go out and earn their daily wages? How long will they stay at home? Then what happens? What about the situation in very crowded cities like Mumbai or Delhi? What do you think are the policy measures which now need to be looked at up ahead?
Sure. Thank you for having me on the show. So a few things. I think you're absolutely right. Social distancing is not possible to implement for everyone. It might work for some companies like IT companies where work from home policies are something that you can implement, but for many other workforce areas that is not going to be difficult. Now within those areas you would have some personnel who are essential personnel. So for that, examples of that would be healthcare workers. You would have those who maintain sanitation, you have police, you have civil security and the like. And for those, I think you also need to have some degree of risk ratings. For those individuals where the risk element of catching infection is pretty high, like healthcare workers, and obviously you need to ensure that they have access to personal protective equipment of the kind which can help prevent infection. And for others, you at least need to inform them of what are the kind of prevention measures which can be instituted, regular hand washing, making sure that they have minimal contact, or if they have contact with any surface where there might be a possibility of infection, then they obviously wash their hands or use a disinfectant. There will be other groups, for example, construction workers, where obviously, because they are daily wage earners, it's almost, it's unfair unless the government puts in measures where they are compensating for wage loss, to expect them to be able to work from home, or for that matter, maids or household help. And in those situations, I think it's imperative that there be a clear risk communication, that people understand that social distancing also means that you can work, but you need to have a minimum distance between two individuals, that if someone is symptomatic, then the contractor or someone who is in charge of that industry has some responsibility of providing items like masks, and also encouraging those who might be showing symptoms to report to a healthcare professional, or also to use protective equipment to prevent further spread of infection. So I think the response needs to be very much graded. Regular services need to continue, but we can certainly be more cooperative with the measures required, while knowing that it's going to be impossible to ensure that everyone stays at home, because that is just not possible to do.
Let me come to that point. Like, for example, in the state of Maharashtra, which right now has the highest number of cases, so we've shut down your malls and your public places of gathering, etc. But something like public transport, as a policy maker, that is a very tough decision to make right now. It's the lifeline of the city. It's also at any given time one of the most crowded spaces in the city. Today you've heard the Chief Minister saying that we will have to shut it down if people go out unnecessarily. But what is necessary and what is not? If you're a daily wage earner, can you really sit at home? Are there enough options if you don't take the local trains? How would you say policymakers seem to be handling such kind of tough questions so far, and what are the challenges up ahead in some of our very crowded areas?
So this is obviously going to be a difficult situation for a policymaker, and the response also needs to be pretty nimble, in the sense that today they might have decided that it's okay for BEST to continue, it's okay for the local metro services to continue, the suburban railway services to continue, but tomorrow or day after the situation might change. It very much depends on the number of cases that we are seeing, and at some point of time, even if you run the services, maybe they can be curtailed, maybe you can encourage for a phased manner where, for those services where individuals do need to go to work, we talk about shifting time, reporting times, so that there is no overcrowding at one point of time when people are reporting to office or returning from office, because you can shift the reporting time for different industries. You will have to clearly closely work with industries, with institutions which will continue to need to run, and ensure that we minimize the number of people who are on public transport. Now, obviously, that's going to be difficult to implement, but if you want to keep running these services, those are the kind of steps we need to take. Plus, obviously, frequent disinfection, encouraging people to not touch public surfaces which might have infection droplets on them and the like, and then wash their hands as frequently as possible after, for example, using public transport, and avoid contact with anyone who seems to be harboring any kind of symptoms which might be indicative of the infection. So yeah, the answers are not simple, but I think we need to be creative in the way we respond.
Well, what could be those creative answers? I think the one section of people really searching the depths for creativity are, market investors. Wondering really what to do. UR Bhatt, thank you so much for joining the India Development Debate this evening. Just wanted to get your sense on, whether you see the worst of the panic over, or is it tough to tell? We've had quite a volatile kind of opening for the Dow Jones today. American markets trying to figure out what's happening. No clear signaling over there, but the worst of the carnage at least not visible in opening trade. How do you see this panning out for the rest of the week? For Indian markets as well? Are you on the sidelines right now? And do you really think that this is going to be a function of how well we deal with the virus, what the numbers are like, and how confident governments sound in how they're dealing with the virus, Mr. Bhatt?
Well, I think there are two ways of looking at it. One is looking at it purely from a historical and a commercial viewpoint, and the other one is from a humanitarian viewpoint. We have a lot of people who are unable to earn their daily wages, so that is the humanitarian angle. But purely from a market and valuation perspective, generally if the market sort of corrects somewhere between 25 and 30% from its recent peak, there is generally some sort of support that comes, and we are at about that point where we have shed about 30% from the peak, and even the US market is somewhere there. But if you really see, the US has used quite a lot of its heavy artillery in terms of cutting interest rates, in terms of a fresh quantitative easing program, and even after that, they are not able to contain this. So that means that finally it is not just measures announced from the fiscal side or from the monetary side that will stop this, because the volatility is very high. The implied volatility is of the same order as what it was in the great financial crisis of 2008. So we are at the same stage, even though the reasons are slightly different. But I think unless the numbers come down, or unless we are seen to be able to grapple with this problem, I don't see the market really is halting at these levels, because there are very few buyers and everybody has turned a seller. But at the same time, these are the times when people can find good value, and people with the money, with a long-term or a medium-term view, they are the ones who are sort of nibbling in these markets and buying. And that is why the markets have not fallen more than what they already have. But I think sum and substance is that there should be some good news on the horizon in terms of being able to contain this. And one good indication is that in China, I think it started sometime in early January. So in about 10 weeks, they have more or less contained this, because today we were reading that they are closing down some hospitals and stuff like that. So therefore, I think more or less they are able to contain to some extent. And so if the timeline for this infection to wear off is somewhere between 10 and 12 weeks, I think we have just started. We are not even about 2-3 weeks in that. So therefore, there's quite some distance to go, and the market can correct. But I think there will be supports at various levels. As of today, say for example, about 8,400 looks like a very good support, because that was the low that we saw last week. But that also could break if the selling continues at the level at the stage at the rate at which it has been going. With $3-4 billion a month, I don't think there are enough buyers in the market to buy that sort of supply. So therefore, I think one has to keep a close watch. But the point is that we have to see some sort of resolution of this problem for the market to really stabilize, and for the uncertainty and therefore the volatility to come down. And that's when I think a lot of new buying would happen.
Like I said, Mr. Bhatt, I think it's going to be a function of where our numbers are and how well we seem to deal with it. You talked about that curve. Now, the problem with the China example is that their data cannot really be verified beyond a point, and that lack of transparency was what kicked off this entire pandemonium in the first place. Do you think it will all depend on what happens within the next 1 week or so, where our numbers really reach, and how efficiently our healthcare system seems able to deal with what's coming and the economic fallout of it?
Absolutely. I think the numbers, because whether it goes to stage 3 or whether it is sort of contained at the stage 2 level itself, I think that's a very important indicator for the market. Because as of now, it looks like we have taken quite some proactive measures, as the speakers before me have said. We have taken quite some proactive measures. We have closed the borders pretty early compared to so many other countries, and we have been dealing with it with utter seriousness. So therefore, if it is possible for us to say after 1 week or 10 days, say that we are not progressing to stage 3, and at stage 2 itself we have managed to curtail this, then I think there will be a celebration in the markets. But till then, I think we have to keep our fingers crossed. As of now, at the 30% correction from the peak, that is the level at which we are almost now, and probably I supported about 8,400 for the Nifty. That is where I think we can currently envisage. But if this continues to stage 3, and if it really becomes something goes to this sort of community level, stage 3, then I think probably there will be further correction in the offing.
That's the thing. Even you look at historical data and examples of when markets have gone through such kind of a turmoil, there are events to back it which are recognizable. There has been nothing of this scale and size in the past to actually be able to compare how markets would react. And as Mr. Bhatt said, markets is one part of the problem, but at the end of the day, if you have a humanitarian crisis, then no talking up or any kind of fiscal measures will really help. So that's really where the crux of the issue is. Dr. Velumani, simple thing, I spoke to you about private testing, and that may be one part of the whole puzzle. Can India really, in your view, do anything to ensure that we don't get to stage 3, considering that we seem to have begun taking precautions relatively earlier? Or does it look like an inevitability that things will get worse before they get better?
It is not that simple to say what will happen, but at least it is a very good situation that we, being the second largest populated country, we are not there in the top 40. So I believe the current measures taken have helped it to be contained. Whether what we have done will be best and we can continue that, or we need to change, this is not something easy to tell. Every day we look at it. Yesterday there was same number of 2 deaths, today only 1 more added. But if they can get into double digits, your panic meter will go far high, and that would be something which we need to avoid. What will avoid it? I think it is the government which should discuss with all the stakeholders and take a call on what is right and what is not supposed to be ignored. Having said that, there are a lot of employment lost. All small employers with less than 30-40 are not knowing is it for weeks or months or quarters, and some of them have wound up. So the unorganized sector unemployment will go high if we don't understand how long this stress will continue, and there is no way of predicting whether it is for weeks or months or quarters.
That really is the crux of the matter, Dr. Velumani. What kind of a step and measure should be taken on this end? So far we've seen some liquidity measures from the Reserve Bank of India. We may see a rate cut, but frankly, from past experience, we know that that's not going to be a game changer. Today, people are talking about things like subsidies and tax breaks for small businesses who might find themselves really with no information of how long they have to shut down. We're talking about, people are talking about universal basic incomes. So you don't have a further drop in consumption and demand. Do you think that it's time to seriously look at such measures, Dr. Velumani?
I see the current generation running month to month, and they don't have any reserves. And if the employers who are refusing salaries for the leaves, that would be a calamity for the families. So government should see at this point of time, before closing everything, this a fine balance between life and livelihood. We should not focus fully on life and lose livelihood, and we should not lose life looking at only livelihood. I think it is going to be, as some of the panelists said, a nimble one, very intelligently. It needs to have two big number of intellectuals looking at what decision will make things not worse. What decision will make things not to go worse. It's very important. I don't think individuals can comment on it. It should be a group of intellectuals who can take a call.
No, absolutely, absolutely. Here we're looking at, what are the possible options before the government. And, Mr. Bhan, as we've been speaking, it's a tough one. In small neighborhoods, there are reports of, in grocery stores, people panic buying of commodities and then wondering if they're going to be there or not, flying off the shelves. So there are small businesses which are really under threat. Dr. Velumani spoke of an example of, having being forced to sit at home, leave without pay, and what impact that can have on small families and economies. Do you think that there needs to be a contingency plan on the economic side as well? Just hoping that social distancing and our stringent measures will work is not going to be enough.
Yeah, so I clearly think that is certainly the case, and I think it's it's at various levels. It's for the central government to think of, it's for state governments to think of, it's for individual municipalities to think of, and smaller communities and individual households as well. I think we're facing an extraordinary set of situations of the kind which we have not seen before, and many parts of the world have not seen before. And I think we might be in for the long haul. I mean, we can hope for the best, but the situation could go worse very quickly, and we've seen that happen in many countries. So I think it's in our best interest to look at both health security and financial security. As was rightly pointed out, health is one element, but we also want to ensure that people have access to financial resources, whether that is through their companies, whether it is through their savings, whether it is through government support, will need to be looked at very closely, because what you don't want is people to not have any support at all. We keep talking about things like social distancing, but at the heart of any response like this is the requirement for a solidarity. And that solidarity requires an element of ensuring that people have some degree of safety to look forward to, which makes them feel that, one, the government is in control, and also makes them willing to abide by requirements like isolation and quarantine, or work from home requirements for that matter. So unless we can assure people and ensure that the infodemic which is out there, or a panic situation which is starting to set in, as you rightly pointed out, with some with panic buying happening at grocery stores or the supermarkets, the only way to respond to that is to assure people that we are in control, that we are keeping a close watch, that we have instituted measures to respond to this growing numbers, that we still are very much in control, and that we will keep responding in a proactive manner to ensure that, one, people are protected, and that their livelihoods are also being addressed, or are on top of the mind for some some parts of the government, and so that the health folks can focus on that issue, but the finance folks and social justice folks and other ministries can also keep in mind the challenges of living in an age where you might not be able to go to work, or you might not have access to your daily employment. So that is certainly going to be very challenging, but it's important to do that to keep the panic situation under control.
Absolutely, and there are so many elements to what is happening before our eyes as we try to capture it. Dr. Agarwal, you wanted to come in, and let me get some inputs from you also. At a time when you have patients or people who are supposed to be in quarantine running away, the government of Maharashtra is actually putting stamps on people's hands when they come out of the airport in indelible ink, so that other citizens can recognize that they are supposed to be in quarantine. I mean, this is really happening today. And this tells us that we have to brace for what comes next.
So in any way, the government is having a policy of restrictive testing only for symptomatic cases. All these cases who run away probably if they become symptomatic, they will be caught immediately. And if they remain asymptomatic, the presumption of the government is asymptomatic cannot be transmitting infection as much as symptomatic cases, which is based on the assumption that it is the lower respiratory tract infection which causes breathlessness, which causes more infection. And this is the policy the government is undergoing. If government was doing testing of these cases, that means everybody who is coming out, if the government was doing testing of asymptomatic cases, then this probably would not have happened. There is a medical indication that the symptoms come on day 5, but the test can become positive on day 1. And if these cases, when they are quarantining this patient at admission, if they test them, probably this type of people running away may not happen. At the moment, there is not enough counseling by the government to the patients why quarantine is important. The patient feels that they are quarantining me without doing a testing. Why? They should have done a test. If I am positive, quarantine is justified. And this requires a very high level of education and counseling, which otherwise cannot happen.
And lack of panic as well. Also, no vilification of those who find themselves in quarantine for whatever reason. That social ostracization will worsen the situation. So tricky times ahead. We all have to do our part. I want to thank all of you for joining us on the first big debate right here on the India Development Debate. Remember, we are keeping it safe. We are following social distancing. We're bringing you this show from a remote location. The team members who have put this together, many of them working from home today. We'll take a very short break. When we come back, we're talking about the Yes Bank rescue plan. The new management with several of those who are buying into the Yes Bank revival dream had a press conference today. We are going to review whether this plan will actually work and what are the big questions that are raised about the Indian banking system which still need to be answered. All of that when we return.